Welcome to Adapting Place. IV therapy complications are very important information you're supposed to know. They're very good, even if you're in nursing school or anything like that. But these are really good information. They are nursing practice that is basic, and your board may ask you questions about it, how to identify them. This is the second video we talk about extravasation and infiltration. The next one is phlebitis, hematoma, embolism. You have to be able to identify them. What is your intervention? That's the question they're going to ask you. Straightforward. That's all, right? So the first thing, as usual, I'll try to make a very short lecture about key concept. So we start with phlebitis. It's basically it's a form of infection, but it's not true. It's just inflammation, right? Inflammation of the IV site due to the vein. So actually inflammation of the vein itself. So you get inflammation of the vein, and then you see certain signs of infection, but it has not led to complete infection of the vein. So it phlebitis. What is the problem? What are the causes? This may be due to the IV catheter itself, right? IV catheter can cause that, or this mechanical irritation, too much movement. If no mechanical, it can be chemical spillage, right? At the site of the IV insection. Or it may be because of bacteria, true bacterial infection. So these are causes. That's why you want to stabilize the IV as much as possible. What would you see? Signs and symptoms. Because it's a form of infection, inflammation. Like I said, it's an inflammation. You see signs of inflammation. You don't need to memorize redness, or you may see warmth or swelling as blood flow there at the site. But then look at the vein. The vein, you're going to have like a palpable cord. There's going to be pain along the IV itself, the vein itself. If you watch the vein, you will see it. And this is the key buzzword, palpable cord, um, or hardened vein that tells you this is phlebitis. Um, the skin around it can be feel hot, like you said, in the concept of infection or inflammation. What is your management? Intervention. In your NCLEX, every content you see, figure out what do you do, because nurses are managers. They'll figure out how to fix the problem, right? The best thing, stop the IV. Okay. And place another one, new site to prevent the ongoing problem. Now you got to take care of the condition over there. Put the warm compression over there to help with the pain and the edema and all those things, and monitor for signs of infection. It's not a true infection, it's inflammation, but you have to monitor for that, like drainage, getting drainage from the purulent drainage. And that's all. This is what it means by phlebitis. This is, if they ask you, trust me, they'll ask you what it is, how do you see it, and how do you manage it. That's all. The next one is air embolism. Air embolism is very dangerous. It means air has entered into the bloodstream through the IV site. So IV site. So IV site is acting like a conduit, and this is a life threatening, and it's an emergency. If you don't do something quickly, patient die. Since it's an emergency, think about it. You're going to have signs and symptoms of distress. Don't memorize it. It's our concept, like I call it, signs of distress, right? It's going to be acute onset of shortness of breath, signs of distress. Patient is going to have chest pain. It's an emergency, right? Um, they may feel like impending doom, like they want to die. And they will feel very anxious, diaphoretic, and if you don't do anything, you end up going cardiac arrest, because this is a bad problem. So what is happening? Air is rushing into the IV and it going to the bloodstream. It's on when you get to the bloodstream, it's going to the heart and then it's going to your lung, and then you die from it. So what do you do? Intervention. where we got to stop the poison. So stop the IV, right? And then what you do is you clamp above. You put the tourniquet, whatever, above the IV side, so no air continue to like escape through. So clamped above the side. Then place the patient in the Trendelenburg. That means head down. So Trendelenburg. So head down, and then on the left side. So left lateral decubit with the head down, left lateral Trendelenburg position. And these will allow the air that has escaped into the heart to be on top, right at the right atrium. So you can pull it out from there. You don't have to do that, but the management is to put the IV in and pull the air molecules that has escaped into the right atrium. So that's why you put them into the head down, left side, allow the air to arise up, and then we can pull it. But you, the nurse, you don't need to do it. Then what you do, you give the patient oxygen. Okay, you monitor the client, and then you let somebody call HCP. You don't go and call. Stay with the patient, let somebody call HCP. How do you prevent it? You make sure you prime the IV all the time. You check in the IV before you use it, but prime the IV so that if there's any air inside, it get escape, right? The next one, we already, hematoma. That means blood is outside. So blood is outside the vein. So it's around the vein, but it's outside it. Um, who you will see is there will be blood under the skin. So you see some swelling. You see some lump. You can see some bruising, right? You can see these bruising over the skin. That is hematoma. The patient may have some tenderness, and then they may have some warmth on the skin too. But lump, bruising, and swelling is consistent with the hematoma. What do you do? How did this happen? It's probably too much pressure, or you poke near the vein multiple times, and blood escape into the surrounding. So you should make sure your proper technique, less pressure, but the bump need to be put. You have to apply pressure to prevent further. So intervention is apply pressure to the site. Initially, cold therapy, right, to help with the swelling. Then after 24 hours, this is key. You're going to apply warm compression. So cold first, then to help with the swelling, then 24 hours warm compression to allow reabsorption. Okay, reabsorption of the basically reabsorption of the blood. So that's what you do as this second step after 24 hours. Then you monitor for bleeding. And that's all. So these are three complications you need to know and how to recognize them and how to manage them. Take care of yourself. You can watch the other one, infiltration and extravasation. And if you get those five information when they have you ask you question on IV therapy, it's going to be easy. Take care of yourself. If you like this video, share or join our membership, adaptingclass.com, or subscribe to our unit. Take care and bye. Good luck on your exams.